My name is Kelly Hull. I'm the nursing supervisor with the ARC of Rensselaer County, and the purpose of this video is to provide support and guidance in the case of a COVID positive exposure here at the ARC. An exposure is determined by guidelines established by the Department of Health when COVID first started. Person A would be someone who is a lab confirmed positive case. Person B would be someone who has direct contact with that lab confirmed case. And person C would be a contact of a contact. So for illustrative purposes, we would say that a staff person who was exposed outside of work to a lab confirmed case would be person B, and then anyone that they had contact with while on shift, including staff and individuals that we support, would fall in the person C category. So we would not need to quarantine unless person B either developed symptomology or had a lab confirmed positive case themselves. This is important because you may find that there are times where, because of these exposures, there are additional things that need to take place in the houses in order to keep everyone safe. It will look an awful lot like what we're already doing, what everyone's been doing very successfully in keeping everyone safe and healthy, which is continued vigilance in making sure that you are washing your hands as much as possible, that you're keeping your mask on and wearing it appropriately. Which means not keeping it below your nose or below your chin, and keeping it on at all times while you're in the residence, particularly if you're doing care with the folks that we support. It means continued vigilance in terms of your cleaning and disinfecting, making sure that you're wiping down areas before and after you use them, helping the folks, making sure that their hands are clean, that they're washing their hands multiple times a day, making sure that you're not touching your face, making sure that frequently touched surfaces are cleaned and disinfected, door handles, remote controls, light switches, and such. What would change in the event of a COVID positive case might mean offering the folks that we support the opportunity to wear a mask while you're performing personal care if they can tolerate wearing the mask. It's understandable that some of our folks just won't tolerate that at all, but as best you can, maintaining social distancing. Staggering meal times is something that becomes important because the less people can congregate together, the less the spread is possible. So making sure that meals are staggered, and if that's not possible, again, making sure that 6-foot social distance is maintained as well. Some changes that you would see would be working with your house nurse, your residential RN, for instruction on any new monitoring that might take place. Particularly with additional temperature checks and oxygen saturation monitoring. We have the O2 sensors that slip over the finger, where you may be instructed by the nurse to do that either upon calling the nurse or at different times during the day, much like you're doing with the temperature checks already. We would want to make sure that bathrooms are cleaned before and after each use, which is something that we should be doing now already. And again, working with the staff in your house as well as your nurse for any new instructions that would be delivered. I want to talk a little bit about what symptoms would look like in our folks, particularly because we have a lot of people that are nonverbal and can't say, I don't feel well, or my throat hurts or whatnot. The key symptoms are still those 3 things that we hear about all the time: dry, hacking cough, shortness of breath, and a temperature over 100.4. But other things that people are coming down within what the CDC is talking about are things like body aches, chills, a new loss of sense of taste or smell. And how would we know that in the people that we support? Again, because they're not able to tell us that. So body aches might look like someone who would normally get out of bed and have a routine who doesn't want to get out of bed. They don't want to take part in activities that they used to enjoy. They may have a change in their behavior. They may have a low frustration tolerance, meaning that whereas before little things that might not bother them really annoy them at this point. So anything new in terms of their baseline, you would definitely want to reach out to your house RN to discuss. the chills that people talk about with COVID is kind of like a teeth rattling chill, a shivering that's not controllable. It's not, just that kind of little goosebumps that you might get with a little cold chill. It's nonstop teeth chattering is how it is described, which would be something that you would visibly see someone going through. And then in terms of loss or taste or smell, again, if someone can't tell me that they can't taste anything, how would I know? And that might be someone who really enjoys something, a particular food, not wanting to eat it any longer or not wanting to drink any longer. Additionally, if they're having respiratory symptoms like a sore throat, you might notice that they may clear their throat frequently, or they may be drooling a little bit. If they've never drooled before, maybe they're drooling now, or they're excessively drooling because it hurts to swallow. So because you're the frontline workers, you know the folks better than anybody else, you're going to see those subtle changes very quickly and be able to act on them. So you're going to want to reach out to your house nurse or nurse pager if you have questions or concerns, always following your instructions on your parameter sheets. Again, the key things that we're looking for are a temp over 100.4. If you are instructed to do O2 monitoring, you would most likely be given the guidelines of any saturation less than 90%. You would reach out to the nurse as well. I'm available anytime to staff if they have questions or concerns. And always, if you feel that it's an emergency and someone requires immediate medical assistance, you're always going to call 911. Additionally, for the folks, we can utilize things like telehealth through their primary care provider or through concierge medicine. In terms of yourself, if you're not feeling well, if you're sick, please stay home. Make sure you're communicating with your immediate supervisor to let them know. If you think you've been exposed, make sure that you contact your immediate supervisor and let them know. Again, you can always contact me and let me know as well. I'm happy to triage anything with you. If you want to be tested as an essential worker, you're able to be tested. We can work with Whitney Young to do that, or there is the testing that's offered by the state down at SUNY Albany. As always, if there are questions, issues, or concerns, reach out to your supervisors first, your ROMs or coordinators, your residential nurses would be happy to help. Thank you.